Welcome everyone, and thanks very much for coming along to our 11th CoRE conversation. These are short 30-minute sessions where we look at a particular topic and provide info for our CoRE member organisations. So my name is, also today we'll be looking at workplaces, psychosocial health and CoRE, and what CoRE member organisations can do to create safe, equal and inclusive and healthy workplaces. So my name is Melissa Morris. I'm based out here in the Wimmera, in the western part of our region, and my role is a senior CoRE consultant with Women's Health Grampians, and I'll be delivering today's training with Rose Jury, who's our Manager of Strategy and Programs and is coming to you from Ballarat. So as we kick off, I'd like to acknowledge the traditional owners of the land on which we're coming together today. So I'm coming to you from the lands of the Watchabollock, Jardwa, Jardwa-Jarli, Yapagulk and Wagaya people. And I know down in Ballarat, many of you will be joining from the Wadawurrung country and throughout the region as well. So I would like to pay my respects to elders past and present and any Indigenous people with us here today, and acknowledge the ongoing connection to country and culture that First Nations people have. Sovereignty has never been ceded, and this always was and always will be Aboriginal land. So today, what we're going to cover in this session, and we thought it was timely to look at the new occupational health and safety psychological health regulations, which were introduced in December last year. We'll briefly talk about those regulations, the important role of workplaces in promoting psychological health and preventing psychosocial hazards. We're going to look at 3 of the hazards that are included within the new regulations, and we'll look at what support CoRE can provide member organisations. So this recording will be made available on our YouTube channel, and we'll send a link out to you, and also any of the references and materials that we discussed today will be sent out to you as well. So let's get into it. So the new occupational health and safety regulations came into effect on the 1st of December 2025. Essentially, these regulations strengthen the existing OHS framework in Victoria and recognise that psychosocial hazards are just as harmful as physical hazards, and therefore they should be treated and considered the same and with the same level of thought and consideration in workplaces as physical hazards do. The new regulations provide clearer guidance to employers on their duty and their obligations to protect employees from psychological injury. And they take, because they've come through the Occupational Health and Safety Act, they have a real emphasis and approach on risk management, and they create obligations for Victorian employers to identify psychosocial hazards and to control risks. So under the regulations, and what was in effect anyway, was that employers must provide and maintain a working environment for their employees that is safe and without risks to health. We're very familiar with that in terms of many of those, physical risks that exist within our workplaces, but the definition of health has been extended and expanded to include psychosocial health. The regulations create specific duties for employers to identify and control risk measures. Identify, control and review risk measures. So the diagram that's on the screen really covers the steps that workplaces need to go through, and very familiar with, these steps would be very familiar to people looking at all the other risks that we've been looking at for many years. But the first step is to identify hazards, the psychosocial hazards that exist in the workplace. And obviously consultation with staff is a key part of all of this, and certainly staff will help in the identification of those hazards. The second step is to assess risks, and it's probably fair to say that across an organisation or a workplace, there can be different risks experienced in different units or parts of the organisation. So, for example, if there are parts of the organisation where there may be staff that work in client-facing or customer-facing roles or go out on home visits, site visits, etc., there can be a different risk profile for those staff and different risk of psychological hazards for those staff compared to staff that may be working in an office-based environment. So definitely assess the risks, and they can be varied across the organisation. The third sort of step is to control the risks, and the compliance code that Worksafe have put out really have a very comprehensive example of the kinds of risk control measures that can be adopted. And then finally, to, as we do with all OH&S issues, review and revise risk control measures and, adapt them if need be. So they're the sort of the duties for employers. So what are psychosocial hazards? It's a bit of a mouthful. There's psychosocial hazards and there's psychological harm. So psychosocial hazards are a factor that may, or factors that may arise in the working environment, so it's in the workplace, and that cause an employee to experience one or more negative psychological responses that create a risk to their health and safety. So, and we know that the harm and that can come from psychosocial hazards and injuries is extensive and can be just as impactful and impact for a longer period of time than many physical injuries. So again, the diagram on the screen shows the sort of extent of areas that we need to look at in our organisations that cover, the design of our work, the way, the systems of our work, so the way that work is planned and done, the management of work, and that includes the responsibility for the control of sort of operational decisions, the carrying out of work, so how we actually, how and where our work is done. And finally, and I think significantly for our work in CoRE, is personal or work-related interactions between other employees and also between employees and contractors and customers and clients, etc. So really looking at all of those factors within the workplace and how we can identify and control those risks. So some of the examples, it's a really comprehensive range of examples that are included in the compliance code. Things such as aggression or violence in the workplace and bullying and sexual harassment are topics that we're very familiar with, and organisations have had obligations to respond to them. But they cover very other topics such as high job demands, low job demands, poor organisational justice, which we'll look at in a minute, poor environmental conditions, remote or isolated work, exposure to traumatic events or content. And for us working for organisations that work in response to family violence or other incidents, that exposure to traumatic events can be quite significant. So very comprehensive range of psychosocial hazards that are looked at, and we're going to look at 3 of them in particular. So we'll be looking at, and we think these hazards have particular relevance to core member organisations, and also, important for us to apply a gendered lens to all of these hazards. And we thought we would look at 3 of them in particular. So we'll be talking about workplace sexual harassment, we'll be talking about gendered violence, and we'll be talking about poor organisational justice. So just to start us off, workplace sexual harassment. So We know already that workplace sexual harassment is covered by a range of legislation, such as the Equal Opportunity Act, the Sex Discrimination Act, the Fair Work Act, and the Occupational Health and Safety Act. And so these new regulations clearly indicate that workplace sexual harassment is a psychosocial hazard that should be considered by organisations. Under these various pieces of legislation, and they all have similar definitions of workplace sexual harassment, employers have a positive duty to eliminate sexual harassment, discrimination, and victimisation in the workplace. And employers can be liable if they do not meet this positive duty. So organisations have to do a whole range of prevention and response work to ensure that they have exercised that positive duty. We know that workplace sexual harassment is an occupational health and safety issue. It can lead to negative outcomes for staff that are experiencing workplace sexual harassment, such as feelings of isolation, stress, depression, anxiety at work, physical injuries as a result of sexual assault, illness as a result of stress caused by workplace sexual harassment. And then there's a whole range of additional impacts, including impacts on workplace performance, career progression, and a whole range of factors. So really important for organisations to address this. And we know that workplace sexual harassment is prevalent across our workplaces. So I'll just check the stats. In the 2022 Australian Human Rights Commission National Survey that happened, they identified that 1 in 3 people experienced workplace sexual harassment in the last 5 years. And that is experienced differently. So for women, 41% of women, or 2 in 5 women, have experienced workplace sexual harassment in the past 5 years. And 1 in 4 men had reported experiencing workplace sexual harassment. So there is a sort of different experience. And for non-binary Australians, approximately 2 in 3 non-binary Australians had experienced workplace sexual harassment, so higher experience there. And we also know that there are higher rates of workplace sexual harassment for people with a disability, for migrant and refugee people, for younger workers, and Aboriginal and Torres Strait Islander people, and the LGBTQIA+ community. And as we see with other forms of gendered violence, we know that young women, for example, experience significantly higher rates of workplace sexual harassment than young men. So we've got those intersecting factors influencing the exposure to and experience of workplace sexual harassment. I think across our lifetime, over close to 80% of workers will have experienced some form of workplace sexual harassment. So I guess with looking at these new regulations, again, the emphasis is on that cycle of identifying the risks, controlling the risks, and monitoring them. So some examples, the compliance code that has been provided by Worksafe has specific examples for all of these individual psychological or psychosocial hazards. So some of the examples that are included in relation to workplace sexual harassment include for leaders to commit to creating and developing a culture of respect and inclusion. And an inclusive and a diverse workplace creates a lot more opportunity for a safe and healthy workplace. For supervisors and managers to really role model respectful behaviours, and that's so critical. We really encourage that active bystander culture within workplaces, and ultimately, in the first place, a workplace where sexual harassment does not occur. Also, a prevention plan, and so really we see a strong alignment between the prevention of workplace sexual harassment and then the actions that need to occur in workplaces to create a gender equal workplace as well. Some other sort of more practical examples, that are included in the code include to sort of design work so that employees don't work alone, particularly for higher risk times or shifts or tasks, and to clearly communicate the behaviour expectations to clients, customers, and the public. We know that, I think, in the Commission for Gender Equality in the public sector sort of identified in the last gender audit that about over a third of workplace sexual harassment in those organisations comes from members of the public, or clients or customers. So it's important that we create that internal safe workplace, but also clearly communicate to our customers that this behaviour isn't acceptable. We have done a previous CoRE conversation on workplace sexual harassment and also dealing with disclosures, and they're available on our website as well to give a little bit more information on them. And of course, we deliver workplace sexual harassment and active bystander training to organisations in the Grampians region. Rose, over to you for the next one.
Thanks, Melissa. The second example of a psychosocial hazard that we're going to be diving a bit deeper into is gendered violence. And of course, you will see a lot of overlap with workplace sexual harassment. Gendered violence is essentially any behaviour directed at or affecting a person because of their sex, sexual orientation, gender or gender identity, or because they don't adhere to socially prescribed gender roles. It can range from comments and gestures to online abuse to physical and sexual assault. And examples of gendered violence within the workplace include, all of the above. It includes offensive language and imagery. It includes innuendo and insinuations, questioning or criticising a person's sexual orientation or appearance. It includes stalking, intimidation and threats, and it includes dead naming or misgendering someone deliberately. When thinking about gendered violence and who is at risk at work, the compliance code, and I do urge you to have a read, have a look at that, asks us to ask what are the additional risk factors that might put particular employees at risk of gendered violence, or indeed any of the psychosocial hazards. And when we think about gendered violence, it is things like young people and young women are at particular risk, people with disabilities, employees with insecure employment are at risk, and employees who are already exposed to multiple forms of discrimination. And we, of course, know that people who are exposed to multiple forms of discrimination have much higher rates of gendered violence. So that is why the Commission is, or the OH&S regs are asking us to think about these groups in particular and to really take an intersectional gender lens over how we are assessing risk in this respect. Sorry, Mel, can we just go back? Thank you. Some of the examples of risk controls. So this is basically what can we do about it? How can we prevent it? That's how it's framed in the compliance code. These are just some. They have maybe 15 or so examples under probably each hazard. Role modelling of appropriate workplace behaviour, developing and communicating an organisational plan to prevent gendered violence, designing non-gendered uniforms, having and structuring and scheduling meetings and forums to be inclusive, monitoring work environments, including online spaces for harmful behaviour, and indeed some of the risk controls that Melissa talked about in relation to workplace sexual harassment. The next psychosocial hazard that we thought we would dive into was poor organisational justice. So this can be thought about in three ways. It's situations where people in positions of authority at work do not apply processes fairly when making decisions, and that's procedural fairness. Where relevant employees are not given necessary information, that's informational fairness, and where employees are not treated with dignity and respect, and that is interpersonal fairness. So this might be things like unconscious bias in recruitment practices, or indeed in the allocation of work or in decision-making processes. It might be not having a toilet for women doing outdoor work who need to change tampons or go to the toilet. And that's an example of where dignity and respect has really been infringed on and may well be characterised as a psychosocial hazard. Not responding in timely ways to complaints, or not being clear about how you make a complaint or how decisions are made. And if we think about workplace sexual harassment, for example, the damage that can be done when psychosocial hazards interact with each other, it can risk greater psychological harm if there are multiple psychosocial hazards acting on each other. And again, there's an intersectional dimension to this work. So the compliance code specifically talks about how an employee or group of employees might be specifically impacted. So, for example, people with disabilities, young women, again, people from migrant backgrounds. There is a power dimension that is at play here. And there are a few other examples on the slide, and again, more in the code. In terms of risk controls, so what we can do about this, Mel, can you click to, yeah. Well, again, it is things like fostering a leadership culture, one that really values transparency, openness, respect, fairness, equity, performance measures that are based on criteria that are indeed within the employee's control, supervisor and management that regularly provide constructive feedback, standardised, valid, reliable selection and recruitment methods, and indeed unconscious bias training, for example, for recruitment panels. Telling employees about decisions that affect them and the reasons why. Providing employees with a mechanism to appeal. As you can see, it's about procedural fairness. You can see these examples of risk control are all about communicating policies. They're about the procedural informational fairness as well as interpersonal fairness. And they are really, if we pull out some of the key themes, what becomes clear for these three examples, and indeed the other psychosocial hazards that Melissa referred to early on in the presentation, the key theme is really about creating a workplace safety culture that promotes psychological health. That this needs to be part of your OH&S systems. And there is a template that's quite helpful to steer you in this direction that's included in the compliance code. So it's quite useful to think in terms of prevention and response, and the themes in terms of the risk controls that are set out are broadly around leadership. That comes up throughout, having really clear policies and expectations, having leaders that role model respectful behaviour. As Melissa said, this is OH&S, it's a risk management approach throughout. Risk assessments are a key part of how we think about psychosocial hazards going forward. And part of that is also consultation with staff, which I think is an important part of thinking about psychosocial hazards in particular. Record keeping is also really important in relation to this. Workplace culture, organisational values and behaviours, leadership statements around creating a workplace safety culture is really important. And knowledge, providing training for staff, although the code does say training can't be the only way that you mitigate psychosocial hazards. It's one string to your bow. And I think, as Melissa mentioned as well, there are certain workplaces that are exposed by the very nature of that work to psychosocial hazards. Those hazards may not be able to be eliminated, but it's what an organisation is doing to reduce or mitigate risk. There needs to be quite clear processes and record keeping around that. In terms of response, providing individualised, person-centred support and responses that values complaints as a way of actually improving culture. Reporting, reducing barriers to reporting so that people are clear on how they can report in this respect. And again, record keeping comes up again in this respect. And monitoring, regularly collecting, reviewing, reporting on data. And again, consultation of staff comes up here as well. Regularly review and update plans and be transparent as an organisation about what is being done in this respect. There are a lot of support services that are and support organisations that can support you. I know both Mel and I have mentioned it. The compliance code is worth a read, and it's really straightforward, and it does really help you get your head around what psychological health, what hazards are, what psychosocial harm is, and what we need to be doing about it. We've got the Victorian Equal Opportunity Human Rights Commission, which has specific tools around sexual harassment. There are a number of different places that you can go, whether you are an employer or employee, around psychosocial hazards within an OH&S context. And I'd also like to mention the Working Women's Centre in Victoria, which is based in Footscray, and that gives free and confidential legal assistance to women about issues within workplaces. And that brings us to our very quick overview of psychosocial hazards. There are a number of different things that CoRE can do, that we can do to support you. So your CoRE consultant is available for one-on-one advice. We have a number of different training programs that touch on different aspects of psychosocial hazards, like workplace sexual harassment, being an active bystander, so creating a culture that speaks out and can challenge some of the things that might be going on. Intersectionality training, this comes up again and again, thinking about the harm that might be done to people from diverse backgrounds. Gender equality for managers is also relevant in this space. And as we said earlier, there are some CoRE conversations if you want to kind of get up to speed on a few other things like responding to disclosures or workplace sexual harassment. By all means, you can go online. They're on YouTube. They're available to watch whenever you want. But do reach out and get in touch with us if you need to. I'm not sure if we have any time for questions in the end. I don't know if there are any questions in the chat. But really, this was intended to be a quick overview of some of the things to be thinking about in relation to this new dimension to OH&S legislation. So please do reach out to me or Melissa or to your CoRE consultant if you have any questions.